Hi, I'm Dr. Jim Kenealy. I'm one of the ear, nose, and throat specialists here at Reliant Medical Group. As an ear, nose, and throat doctor, I get many questions about ringing the ears, or as doctors call it, tinnitus. There can be all sorts of tinnitus. Some people have a high-pitched ring. Some people describe a tension wire like humming. Some people describe sounds like crickets or a waterfall in their ears. People say, well, why do I get tinnitus? Well, the most common cause for tinnitus is hearing loss. The tinnitus frequency usually matches the frequency of the hearing loss. So if you have a high frequency hearing loss, you're going to get high-pitched tinnitus. If you have a lower frequency hearing loss, you may get a lower pitched water-like thumping tinnitus. The tinnitus seems to get better and worse during the day, when in reality, it's your level of attention to it that really changes. The more you think about the tinnitus, the more you let it bother you, the more it will bother you. Sometimes it helps to distract yourself from the tinnitus. In the summer, you can run a fan or an air conditioner. In the winter, you can run a humidifier. Sometimes a clock radio with a snooze feature will just give you some background music just to let you get off to sleep or enjoy that quiet reading you're doing before bedtime. What works best is to get a sound wave generating machine. The ones that generate water sounds like waterfall, rainfall, ocean seem to work better than just white noise. So get one that you can select different types of sounds and adapt them to what works best for you. Unfortunately, there's no drug that makes tinnitus better. There are things that make it worse, however, and that includes high concentrations of salt, monosodium glutamate, which is in Chinese foods, prepared foods, frozen appetizers, certain frozen vegetables, caffeine, alcohol, sharp cheeses because they're salty, and loud noises, which can adversely affect your hearing as well. There are certain drugs that can make tinnitus worse. That includes what we call the non-steroidal anti-inflammatory drugs like aspirin, Motrin, Aleve, the types of drugs we often take for arthritic complaints. Certain antibiotics and antipsychiatric medications can also make tinnitus worse. It's very important to check with your doctor if you're on a medication and the tinnitus gets worse. The good news is, when you stop the medication, the tinnitus usually gets better. The most important thing, if you're experiencing tinnitus, is to see your doctor and arrange to have a hearing test done. That way they can find the cause of the tinnitus and make sure that it is nothing more serious.